Welcome back to News This Week in Nursing Homes. I'm Nurse Bug. CMS announced new Medicaid income and resource standards reflecting changes in the federal SSI benefit rate and Consumer Price Index, or CPI. CMS Deputy Administrator Brillman outlined updated SSI and spousal impoverishment standards for 2026. Beginning in the new year, the SSI federal benefit rate will increase to $994 for individuals and $1,491 for couples, based on a 3% CPI increase. Since 1988, CPI has risen 171.1%. Key Medicaid financial standards will also shift. SSI resource limits will remain at $2,000 for individuals and $3,000 for couples. The income cap limit will be $2,982, while the earned income break-even point increases to $2,073 for individuals and $3,067 for couples. For unearned income, the break-even thresholds will be $1,014 and $1,511, respectively. CMS also updated work-related income measures. Substantial gainful activity will be defined as earnings of $1,690 or $2,830 for individuals who are blind. Additional changes will affect married couples when one spouse requires long-term care. Maximum monthly maintenance needs allowance will rise to $4,066.50. The community spouse resource protections will range from a minimum of $32,000 to a maximum of $162,000. Home equity limits will fall between $752,000 and $1.13 million. Earlier updates to monthly maintenance and housing allowances went into effect July 1st. CMS is once again delaying its mandatory off-cycle revalidation deadline for SNFs, and this time the postponement's indefinite. Last week, state affiliates of AHCA received a memo stating the deadline was being suspended indefinitely. AHCA has repeatedly urged CMS to provide relief, citing widespread challenges providers have faced throughout the process. The delay, they said, is largely due to software and logistical issues, including significant breakdowns within the CMS PECOS provider enrollment system. Under the Biden administration's expanded transparency requirements, nursing homes must disclose far more detailed ownership and management info, including anyone with potential control or influence, even at vendor and volunteer level. And those that fail to submit the completed CMS 855A data risk suspension or loss of Medicare certification. AHCA reported that hundreds of members have recently experienced new technical failures in the PECOS system, prompting its formal request for suspension. CMS has reportedly agreed, but providers are urged to stay prepared. Facilities that have already submitted documents and received follow-up requests must still meet due dates and should contact their Medicare administrative contractor if system problems threaten timely submission. AHCA leaders say the extensions necessary to protect continuity of care, adding providers remain committed to transparency but need reporting systems that don't put paperwork over patients. AI and emerging tech are becoming essential tools for skilled nursing operators. With reimbursement models varying widely from state to state, providers say technology is helping keep pace. Ignite Medical Resorts Senior VP of Clinical Reimbursement Rainey says states use different CMI weights and Medicaid rules, making comparisons challenging. Real-time state-specific reimbursement alerts, she said, are now critical for staying compliant and financially stable. At ARC Care, CMO Dr. Mirza says AI is being deployed to better predict each resident's PDPM classification within the first few days of admission. Early insights help align documentation, clinical planning, and billing. AI is also being used to estimate staffing needs by integrating payroll data into EMRs, flagging shortfalls before they affect care, showing how quality outcomes like infection rates and readmissions will influence future incentive payments. Rainey says the power of AI lies in showing big-picture trends providers might otherwise miss. Patterns in conditions like COPD and gaps in speech or cognitive coding impacting reimbursement, providing a much-needed scrub before MDS submissions, reducing unexpected QM triggers, and shifting facilities from a reactive to a proactive compliance posture. The company's also using AI to forecast budgets before state rate sheets arrive. Both organizations stress that AI supports, not replaces, clinical judgment and doesn't replace the human decision-making skilled nursing relies on every single day. Thank you for joining me for News This Week in Nursing Homes. To get more of Qsource news and info, visit qsource.org to view podcasts, sign up for the newsletter, and remember, for all of your QI needs, call the Q.